Renal colic is the term medical professionals use to describe the pain caused by kidney stones. Renal colic is usually not very difficult to identify because of the discomfort it causes. This pain typically occurs in the lower back or flank area, although it can also appear in the lower abdomen. Renal colic is considered one of the most excruciating types of pain a human being can endure. It's right up there with childbirth, gunshot wounds, and broken bones. One medical website described the pain of renal colic this way: patients suffering renal colic are easy to identify in the emergency room, as they are often found in agony draped over the admitting nurse's desk. Most kidney stones are actually tiny, although some can also be quite large. When you look at them, you wonder how such a small thing can cause such big pain. Renal colic usually occurs when a stone formed by a kidney begins to move from the kidney toward the bladder. It starts to pass through the ureter, which is the tube between the kidney and the bladder, but it gets stuck somehow along the way. As it does, it obstructs the flow of urine from the kidney to the bladder. Pressure builds up in the area, and pain begins in the patient's back and side, below the rib cage but above the hip. As the pain grows more severe, it can radiate into the abdomen, and in men, the testicles. Painful renal colic symptoms can last for hours. They may be accompanied by other kidney stone symptoms too, besides pain, including fever, nausea, vomiting, general restlessness and agitation, and blood in the urine. Kidney stone treatment may be done in several ways, depending on the type, location, and size of the stone. In many cases, surgery isn't needed, and the stone will pass out of the urinary system on its own, although it can cause maddening pain along the way. Doctors recommend that the patient drink lots of fluids, which can literally flush the stone down the ureter and into the bladder. Once the stone is in the bladder, the discomfort of renal colic usually subsides. When kidney stone removal surgery is necessary, several options are available. The most popular is a non-invasive shock wave treatment known as lithotripsy. A sedated or anesthetized patient is exposed to high-intensity sound waves which smash the stone into smaller pieces and make it easier for the pieces to pass out of the body naturally. The procedure is also known as extracorporeal shock wave lithotripsy, or ESWL.